As Gregor mentioned, my introduction to physician assistants occurred in the early years of the profession during my service in the United States House of Representatives. As I worked with the pioneers of your profession, with my colleagues in the Congress, we were able to produce the Health Manpower Training Act in 1971. It was very clear to me then, and it is now, that PAs would forever change the landscape of health care in America for the better. One of the principal initiatives of the Congress in the 70s developed when we found that we needed to work with the health profession schools in order to try to meet the problems we were having with the delivery of care. In fact, there was an expert commission that said we were going to have 50,000 shortage of doctors, 50,000. And we needed to do something. But not only that, there was a significant maldistribution of doctors in our nation, not only by location, but by specialty. And the inability of Americans to gain primary care, particularly in rural areas, reached really crisis proportions. And so Congress challenged the health educators to join us in trying to work out some solutions to the health workforce crisis. The training and deployment of physician assistants was a very important part of that solution, ultimately embodied in what was called the Health Manpower Act of 71, which Gregor mentioned. During those deliberations, my staff and I met with many in the profession, and particularly many of your early members of the PA profession. And also, there were new programs evolving just at the beginning. You remember probably the new programs they started at Duke and at Washington University. One of the most impressive witnesses I remember was Bill Wilson. He was from the University of Utah. Dr. Wilson, who still remains a close friend, testified to the success of Utah's physician assistant program through deployment of trainees to physician offices. He would send them out to physician offices. And I know you've done that. There, they would work side by side with the physician as a primary care deliverer. And this not only assured some exposure to different settings, it also demonstrated to practicing physicians, many wary at first. I remember that. There were many physicians who thought, well, I don't know. They weren't so sure of the expertise that could be brought to them. But this mandatory preceptorship program was so successful there in Utah because they spread them out all over the state. We wrote it into the Health Manpower Act, only programs that included deployment of PA trainees to physicians' offices would be eligible for federal funding. So we got that going that way. And as I worked with the pioneers of the physician assistant profession and with my colleagues on the Health Manpower Training Act, it was very clear to me then, and even clear to me now, that physician assistants would change forever the landscape of healthcare in America for the better, and you're doing it. As physician assistants, you are trained and certified to extend the reach of medicine in primary care, family practice, and virtually every specialty and subspecialty that exists. I thank you for your dedication as frontline providers of health care, and I salute you. The mission statement, and this is very important, of the American Academy of Physician Assistants, speaks first and foremost to promoting quality, cost-effective, and accessible health care. Achieving this mission will require us to think and to act politically. And I don't mean in a partisan way. Healthcare is not partisan. It must not be. Healthcare policy, however, is crafted in a political setting. As physician assistants, you are among those most dedicated to improving health. Your first-hand experience and your understanding of what happens to patients who are unable to access quality, affordable costs at a consistent basis positions you as advocates of tremendous importance and influence, as was with the case of your colleagues 35 years ago. I urge you to be vocal, loudly vocal, visible, that be seen, and a leading force for advocating the type of health care that is described in the mission of AAPH. That system is accessible, affordable, and provides consistent quality care. Policymakers, opinion leaders, and decision makers at both local and national levels want to see you. They want to hear your stories, and you need to tell them of the phenomenal stories that you can tell about. For instance, how you've treated people, what has been in saving lives. And they need your advice and expertise on what it will take to assure that our system is one that works for all stakeholders. The pioneers of the PA movement were anything but followers. They were leaders in every sense of the word. And I know that you, too, will be leaders to improve the health care of America. Thank you for this high honor.